Hello everyone. This week we will examine such disorders as Pica, rumination disorder, avoidant or restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder. How common are these disorders? The prevalence of Pica is difficult to establish, because of differences in definition, and the reluctance of patients to admit to abnormal cravings and ingestion. An incidence of Pica greater than 50% is considered normal in children, aged 18 to 36 months. Pica is thought to decrease with age. One study showed that about 10% of children older than 12 years engage in Pica. About 5% of boys and girls, and 10% of people with intellectual disabilities, living in institutions, have rumination disorder. Avoidant or restrictive food intake disorder is common among 3% of children aged 8 to 13 years. Binge eating disorder is common among 3.4% of women, 2% of men, and 1.6% of adolescents. Anorexia nervosa and bulimia nervosa are more prevalent among white females, and can be diagnosed in 1% or less of women. Pica. Pica refers to the persistent eating of non-nutritive non-food substances over a period of at least 1 month. The eating of non-nutritive non-food substances should be inappropriate to the developmental level of the individual. A minimum age of 2 years is suggested for diagnosis. Also, the eating behavior is not part of a culturally supported or socially normative practice. Onset of Pica can occur in childhood, adolescence, or adulthood, although childhood onset is most commonly reported. Pica can occur in otherwise normally developing children. In adults, it appears more likely to occur in the context of intellectual disability or other mental disorders. The eating of non-nutritive, non-food substances may also manifest in pregnancy, when specific cravings, such as chalk or ice, might occur. Rumination syndrome is a condition in which people repeatedly and unintentionally spit up, or regurgitate, the undigested or partially digested food from the stomach, rechew it, and then either re-swallow it or spit it out. Because the food hasn't yet been digested, it reportedly tastes normal and isn't acidic, as vomit is. Rumination typically happens at every meal soon after eating. It's not clear how many people have this disorder. Avoidant or restrictive food intake disorder, or ARFID, occurs in cases where clients exhibit restrictive or avoidant eating behaviors that result in significant weight loss, growth compromise, a reliance on nutritional supplements to meet daily energy requirements, nutritional deficiency, like iron deficiency anemia, or marked interference with the patient's psychosocial functioning. Patients with ARFID do not fear weight gain, are not dissatisfied with their body weight, shape, or size, and lack any cognitions typically associated with anorexia nervosa. ARFID cannot be diagnosed in cases where the presence of a concurrent medical or mental health disorder can account for the behavior observed. The diagnosis can be made if the severity of the eating disturbance exceeds that typically associated with the medical or psychiatric condition in question. Anorexia nervosa is often simply called anorexia. It is an eating disorder, characterized by an abnormally low body weight, an intense fear of gaining weight, and a distorted perception of weight. People with anorexia place a high value on controlling their weight and shape, using extreme efforts that tend to significantly interfere with their lives. To prevent weight gain or to continue losing weight, people with anorexia usually severely restrict the amount of food they eat. They may control calorie intake, by vomiting after eating or by misusing laxatives, diet aids, diuretics, or enemas. They may also try to lose weight, by exercising excessively. No matter how much weight is lost, the person continues to fear weight gain. Anorexia isn't really about food. It's an extremely unhealthy, and sometimes life-threatening way, to try to cope with emotional problems. When you have anorexia, you often equate thinness with self-worth. Anorexia, like other eating disorders, can take over your life, and can be very difficult to overcome. But with treatment, you can gain a better sense of who you are, return to healthier eating habits, and reverse some of anorexia's serious complications. Bulimia nervosa is commonly called bulimia. It is a serious, potentially life-threatening eating disorder. People with bulimia may secretly binge, eating large amounts of food with a loss of control over the eating. Then they purge the food, trying to get rid of the extra calories in an unhealthy way. To get rid of calories and prevent weight gain, people with bulimia may use different methods. For example, you may regularly self-induce vomiting or misuse laxatives, weight loss supplements, diuretics, or enemas after binging. Or you may use other ways to rid yourself of calories and prevent weight gain, such as fasting, strict dieting, or excessive exercise. If you have bulimia, you're probably preoccupied with your weight and body shape. You may judge yourself severely and harshly for your self-perceived flaws. Because it's related to self-image, and not just about food, bulimia can be hard to overcome. But effective treatment can help you feel better about yourself, adopt healthier eating patterns and reverse serious complications. Binge eating disorder is a severe, life-threatening, and treatable eating disorder, characterized by recurrent episodes of eating large quantities of food very quickly and to the point of discomfort. People with this disorder feel a loss of control during the binge. They experiencing shame, distress or guilt afterwards and do not regularly use unhealthy compensatory measures, such as purging, to counter the binge eating. It is the most common eating disorder in the United States. To find out more about these disorders, read Chapter 9 of Jengalevsky's book, and the DSM-5 section on feeding and eating disorders.